Hi, my name is Alina Cannon, and I'm going to be talking about the female reproductive system, and then I'm also going to be talking about gynecologic cancer. So, as we know, our female reproductive system includes the following: the uterus, the vagina, the fallopian tubes, the cervix, and the ovaries. So, as humans, our goal is to keep the organs in our bodies clean, and that's for any system, our nervous system, our digestive system, etc. So, how do we keep our female reproductive system healthy? As all things, females should maintain a healthy diet, drink plenty of water, sleep, avoid using tobacco and alcohol and other drugs, and manage stress in healthy ways. Also, as we all should know, cleaning plays an important role in maintaining the correct health for our female reproductive system. So females should use certain soap, natural ingredients in their genital areas. A daily washing routine for your vagina is a good thing, and wearing certain underwear is important thing as well. Even though it may not seem like it, cotton underwear is the best underwear for a female. So, gynecologic cancer is a very rare type of cancer that happens in the female reproductive system. And there are 5 different gynecologic cancers, so I'm going to focus on all of them today. Um, we have cervix cancer, endometrium cancer, cancer that could be in our fallopian tubes, ovarian cancer, which is the main one, the main cancer that a female usually develops, cancer in our uterus, and cancer in our vagina. Cancer develops when the cell walls in a woman's cervix changes. Since the cervix is connected to the uterus and the vagina, the cancer could spread to other organs in the female reproductive system. Early ages of this specific cancer can be treated easily. However, if the cancer spreads beyond the vagina, it can be difficult to cure. Even though this cancer is like in our female reproductive system, like our in our ovaries and stuff, if it spreads outside the vagina, it can get into our lungs, the kidneys. It could be more than one cancer eventually if it spreads outside of the vagina. So, what are signs and symptoms of cancer in our reproductive area? Um, Frequent bloating, difficulty eating, frequent urination, and the number one symptom is pelvic and abdominal pain. If these symptoms occur more than 2 weeks, a woman should see a specialist called an OBGYN, and this is a doctor who looks into the female reproductive system. Recovery and maintaining the quality of life with cancer. Um, this specific cancer can be curable when diagnosed at early stages, as stated before. Living with cervical cancer, the recovery can take at least 6 to 12 weeks after a procedure is done. And after that, 6 to 12 weeks for recovery to be fully cured and free of the cancer. The cancer can affect a patient's emotional health as well as their family and their caregivers. People may experience distress, anxiety, and depression. Maintaining a quality of life can include counseling/talk therapy, social support, medications for depression or anxiety, and cancer education sessions and exercise could be a good way to maintain a good life. The lifespan of gynecologic cancer. The 5-year survival rate for someone who has cervical cancer or ovarian cancer or any other cancer that develops in our reproductive system is 66%. There are many things to consider when thinking about the survival rate, um, such as like race, ethnicity, and age, and also including the stage that a person is diagnosed. And that is very important. Because if a person is diagnosed at stage 1 and then another person is diagnosed at stage 4, their survival rate is different. Because obviously one is in the beginning stage and one is like at the highest stage. The survival rate for Black women is 58%. For white women who is younger than 50 years old is 79%, and Black women 65 and older, the survival rate is 39%. So treatment. Unfortunately, like other cancers, it can be difficult to treat if the cancer is caught at a late stage. Patients do have the option to go through chemotherapy in order to get up the cancer. And then if it's caught at an early stage, doctors may put a patient through interventional oncology. This is a rare cancer treatment that is less invasive, or a patient can go through surgery to remove cancer cells. So lastly, the help from caregivers. Most caregivers try to help patients recover from cancer or patients with cancer by giving a patient a comfortable, safe living setting. Help keep track of patients' doctor's appointments because that can get overwhelming with all the treatments. Most people have to go to their appointments at least 3 times a week. Control the number of visitors, and some caregivers may give support by like socially, psychologically, and spiritual support. Socially, because people may become more distant or get more depressed when they're going through things. So being social is still a good way to help the person get through what they're going through. That also ties in with psychological because people can develop anxiety, depression. Spiritually, because sometimes people feel like God and things like that can help them through it, or it can save he or she, most likely she, because we're talking about the female reproductive system. And then these are my references. Thank you for listening to my presentation today. Thank you. Bye.